Hello, everybody. This is Paul Feuerstein, editor-in-chief now of Dentistry Today magazine. This is quite a project I've undertaken here. And the big problem I have now is that I used to run around to all the dental shows and see all my friends, and there aren't any, but I still have friends. And one of them is right here, Dr. Joyce Bassett. Joyce, how are you?
Hey, so glad to see you.
We miss each other.
I know, I miss you more than you can imagine.
There's those of us who are the big shots in dentistry run around, and it's our extended family. We always look for each other at the dental meetings, and we meet for lunch and dinner and things like that. And it's just been very, very sad as it's going on. And doing virtual, I've done some virtual, Joyce has done some virtual, and you're staring at the computer screen, and there's not an audience that you can tell that actually exists. So you tell a joke and you sort of wait and pretend somebody's gonna be laughing at it. So the problem is we're both in dental practice, and last March things fell apart for me in Massachusetts. We were shut down completely for a couple of months. And what happened in Arizona, Joyce? How'd that all work over
We
there?
were shut down, but not completely. We could see emergencies. And in my practice, I saw the emergencies for my endodontist and my oral surgeon. I had KN95 masks from the anesthesiologist. I only furloughed one person, and like 3 of us went in and 5 to 6 hours a day, cleaned out all the operatories in the office. And then saw whatever emergencies needed to be seen for those 6 or 7 weeks in that period of time.
Now, during that time, did you have any issues? I mean, you're coming in during this whole top of the crisis. How did the staff react to that?
They wanted to come in, the ones that came in. They didn't want to be furloughed. They wanted to help do what we needed to do in the practice. They didn't want to stay home. They were single people and they didn't want to be at their house by themselves the whole time. So I gave everybody the option to decide what they wanted to do and how they wanted to proceed. And then I also gave them all their sick days. I gave them everything bonus wise, and I made sure their money stayed at the same level so that they felt compensated appropriately. You know.
See, we had some issues in my own office that one of the hygienists decided to have a baby in the middle of all this, and she came and said, "I'm not coming back at all." So another assistant has 2 young kids, and she had no childcare, so she couldn't come back. To this day, they both have not been back. So these are issues that I talk to a lot of dentists about that happen. So staffing's always been a challenge, and this has just put a lot of pressure on things. But that sounds like you've got a nice answer. I know you have a great staff.
But I did lose. I lost one. So I did lose one also. I don't think anybody didn't have trials and tribulations in that period of time with their staffing issues and the fear that even your employees had to come to work. And am I safe here? Am I gonna get sick?
Yeah, and you know, we took all the precautions, and I'm sure you did too, with everything, all sorts of masks and gear and all kinds of face shields and whatever you had, and it seems to work. I think, to me, we spent a lot of time telling the patients how safe it was. I empowered everybody in the office. At any time there's somebody in your chair, what you must say to them is at least one thing about, hey, did you notice the air purifier? Did you notice the thing we're doing over here? Did you notice all this? So at least you're reinforcing that whole thing, and that's something we've been able to do pretty well.
Yeah, constantly. We would talk about the doors being shut, how the aerosols were staying inside the rooms, et cetera, things like that. Then they sat down and the HEPA filters blasting right at you. You know, so we have that just to that level, and it really gave the patients peace of mind. And I feel safer here than going to Safeway and going to any place, because I feel like I should sleep here because this air is clean, and we just wipe everything down. So yeah. And so I think it felt good after that. And the patients that were really a little bit more nervous, we have operatories that come right from the front door or the back door, and they would go straight into those operatories and not go through any waiting rooms. So we had that in our practice, which really helped also.
Yeah, that's been a challenge. A lot of dentists have, a traditional waiting room, and you've got patients waiting outside in their car. And I have friends that have offices in big cities like Chicago, and you can't just sit downstairs in front of a building in your cars. So it's quite a challenge. Speaking of the patients, so we were shut down, literally shut down, and the patients also did not want to come in. And one of the problems that came up was we had patients in the middle of treatment. First of all, we had people, they come in on recall, and we say sometimes this fancy word dentists use, let's watch this. All of a sudden, the watch wasn't 3 months, it was 6 months, 9 months, a year. They're showing up now with total disasters, not only on the teeth, but the soft tissue. And this is where I really was having a problem now, and we are right now. We're trying to catch up with the recalls. So how did you address that, or did you?
It was honestly, it was horrible. And on some of our patients, we have a lot of supportive periodontal therapy patients, which they had deep scales and they come in every 3 to 4 months. So the ones that didn't come in, we would tell them on the phone because they weren't happy to leave their house. They were really higher risk. They felt they had comorbidities. They didn't want to come to the dental office. So we would tell them, please get the Sonicare toothbrush and use it 3 to 4 times a day and floss twice a day. And the one that they have is a Diamond Clean. That's the one I like the best with that. And that we would reinforce that toothbrush because that really helps with the gingivitis, etc. What did you do?
Yeah, I mean,
Same thing?
the Philips Sonicare Power toothbrush is been a proven method with study after study on keeping gingival health and keeping oral periodontal health. So in lieu of them coming in, which is not really the greatest thing, but if they would just couldn't come in and say, at least do this whole thing. So what you mentioned, one of the brushes, you said you like the Diamond Clean Smart. What did you like about that?
I like it because it has 5 different things you can do on it. And that's what I tell my patients. I have a lot of veneers and I have a lot of margins at the veneers, and I do not want any recession. So they can use lower the gum level on that. And then I don't worry about abrasion at the gingival margins or on the veneers because I don't want the staining that I've already put in the glaze to be diminished over time. So I want longevity of my restoration. So I have all of my cosmetic patients have that toothbrush because of that setting. Then obviously there's the tongue setting. Then there's the where it's a little bit more aggressive. Then they can use it back in here. So I change it every time I brush my teeth. So I do a little bit here, a different setting here. And then my patients understand that. I say, it's like a wood floor. You don't use a sandblaster, you use a damp mop. So there's areas where you don't want abrasion on the toothbrush. And so now that it has those 5 settings, that's my go-to toothbrush.
You should know, and I have a paper in front of me that I wanted to bring up for this meeting, that the studies that were actually done with the Philips Sonicare Diamond Clean Smart, and this is what they showed, 100% less gum inflammation, up to 7 times healthier gums in just 2 weeks compared to manual brushing. I mean, that's from a legitimate study. And this is what I think sets apart the Philips brand from some of these off brands that you're seeing all over the place on Amazon and places like that. It's a vibrating toothbrush. Well, it's not the vibrating toothbrush. There's so much more involved with a corporation like Philips that does the research. And both you and I have also been in some of the study groups and tried this and tried that and gave them feedback. So, and then they have clinical studies and it's just, people don't understand that. That's the thing. And so, I'm not being, I mean, I want to thank Philips Corporation for hosting us today, but that's not the reason I'm here, is because I believe in the product and the process.
And my mother, she's 92 and she just moved into my house the week after Thanksgiving, and her gums were terrible. She does not use an electric toothbrush. The dentist's daughter, you know how that goes. I got her the Philips, that Diamond Clean toothbrush, and the way it goes around her teeth at the gingival margins, the way it grabs them in the different areas, her tissue is perfect now. It's pristine. And before it was red, inflamed, and there was always plaque buildup. And I couldn't believe it was my mother. So now I'm really loving that toothbrush even more.
So as long as I have the study in front of me, I'll just read you another little piece of it. It said the bristle contours to the shape of the tooth surfaces to give 4 times more contact, which removes 10 times more plaque. So I mean, what else could you ask for? What else? I mean, it looks different. It just looks different, and the patients, once they get used to using it and understand what it's about, will always use it. So let me just move on a little bit. So one of the other products that we have to talk about is teeth whitening, and Philips is probably at the top of the chain on this thing. And when I talked to you the other day, you told me a very interesting way that you handle the whitening for the
Okay,
patients.
so a couple things I've done, because our numbers have gone down on the bigger cosmetic procedures for a little bit, because the patients, some of them are scared to come in and others are scared to spend money right now because of what's occurred. And so for entry point for me, every patient that comes in, even in hygiene, if they're not needing an exam, I'm walking in their room, I'm coming on the left side, I'm saying, hello, how are you? And then they don't have a mask on. And of course I have my mask on and my shield on. And so I can look at them and I look at their teeth and I say, hey, have you been on a Zoom call lately? If they have yellower teeth. And they go, yeah, have you noticed everybody's teeth? Because look at, and I go, I had to do another webinar. I had to whiten my teeth in a while. I put it back in and I do the at-home trays. And I go, do you have your at-home trays? No, I lost my at-home trays. That's a good idea. And then at that juncture right there, I tell them about, and I have my little laminated Zoom, and I show them, when you get done with your cleaning and your teeth will be clean, I can make you some at-home trays and I can put you right in the Zoom machine because I have 2 of them. And then I have a before and after, just picture right there that they can see what it looks like. And I go, and then I know I'm not supposed to take my mask on with my show for a second. I go, see? And then I get back on, and I go, I had to do it. I go, it really makes a difference because when you're on the call, if you don't look good, everybody's staring at themselves like I'm staring at you or am I staring at me? And you see what you look like and you really don't want to look at yellow. You don't want to look at yellow. And it really helped because we had our numbers are going down production wise and it helped the numbers boost. And then once they get done with that and they look in the mirror, they go, hey, what about this chip? What about this? And so then I'm doing more bonding. And then they're more in tune with what they look like and how they want to feel because they feel better when they have wetter teeth. So that's what I'm doing. And I have a hand mirror and I give them the hand mirror after mine. So they're looking at the same time. Then I walk out of the room.
No, you made a great point because we're sitting here like this. You see people on TV.
Yeah. Like, see,
Look at that. I got to get a touch of. I'm coming down to Arizona for you.
Yeah, I'll do it for you. I got 2 machines. I got 2 lights. Yeah. I really think it's important. I think it makes you look younger. You feel better. And everybody right now, they're not spending money on travel. They're spending money fixing their homes. And because they're seeing everything around them, the landscaping, the things that are broken. So I go, fix your face and your teeth. Let's fix nose to chin. Get your gums healthy. Let's take care of any decay or any problems that you may have, any restorations that need replaced. And then let's just whiten your teeth. And it works. Patients are doing it and they're really happy.
Boy, that's great. There's a lot of information out there too for dentists who are watching us here. Now, some offices have a system where they sell the brushes from their office. Some of them give them away as prizes for this, that, and the other thing. So for those dentists who are watching here, if you just go over to www.phillipsoralhealthcare.com, there are all sorts of specials for your office and things that you can do and little ideas of how to make this work for your practice and keep the patients rolling because they're going to say, well, where am I going to get one? We'll say, well, we happen to have them right here. If the patients are still aren't wanting to come in, like you were saying before, and they say, well, how can I'm not going to the store. They can actually go to the phillips.com website and there's a place that says consumer products. Just click on that and they can just buy it right there. So, there's ways for the people to get this and get this healthcare. And I think it's our job, you and me and the staff, talking to the patients on the phone all the time saying, don't forget, you can, some of this you can do yourself, not everything, but you got to at least stay in maintenance. And still to this day, I have families right now where some people in the family will come to the office. They go, oh, Sam doesn't want to come in because he's still too scared to come in. So again, you have an opportunity to say to your patient, give this to Sam, bring this home to Sam, whatever it is. Anyway, it's good to see that at least both of us are surviving here. It's been challenging. I'll be honest with you that as this year has begun, actually the end of last year, the beginning of this year, our production has gone up.
Yeah,
which was
good.
Part of it's that people are coming in with just catching up for lost time.
Right.
Part of it, unfortunately, is that person that had that little chip got worse and worse and worse over the last year. But they're accepting the treatment now. They're not asking as many questions as they asked before because they're getting scared. Oh my God, I used to come every 6 months, every 3 months, and now I'm not coming in. Yeah. They get nervous. And then we say, and it's not as a sales point, say, yes, look what happened to this tooth. And you use your intraoral cameras and all these other things.
Right.
So it's actually been, in a funny way, a little positive to some parts of the practice. But again, the focus is to keep these patients in optimal health, which makes our jobs much, much easier.
I've had a lot more single tooth dentistry, that's for sure. I was talking about the cases that have gone down. My production numbers have been on the bigger cases, 10 unit veneers, 20 unit veneers, open vertical, those kinds of cases.
Oh, sure.
Some people have said, okay, I'm going to wait till COVID's over. I have so many patients go, I'm going to get my second vaccine and then I'll think about it. It doesn't mean they're not going to do this work, but some of them are not doing the work as readily now as they were before. And that's why I said the supplemental of the single tooth dentistry, the bonding and the whitening has really helped the practice. It's maintained in January. We maintained our numbers from last year. From last year we finally came back up. But we lost people here in Arizona too because we had so many Canadians.
Oh,
coming in. People
yeah.
come here in the winter. Yeah. They come here.
Oh,
Yeah. They come here in the winter here. And now with the borders being closed, because Arizona is a wonderful place from October to May, and people have second homes here. And so some people haven't traveled as much as they
well,
used to.
that's true.
Yeah.
Well,
For Arizona.
but
Yeah.
I really got to say,
Mm.
I've been so nice to catch up with you like this. I
Yes,
have to
it
really
is.
have to thank Philips Corporation, Philips Oral Healthcare for helping us put us together. You know, you did us a favor. We haven't dated
I
for a
know.
month.
It's so good to see you. I miss you very much. We'll all be together soon, I'm sure. With the
It should
vaccine,
be.
it's going to help.
I think so. I think so. I think that everybody's getting a little calmer. I hope everybody doesn't get too complacent, because it's not, the vaccine's not the end of the whole story. There's still lots of things we have to deal with, but I think there's a better feel from everybody, and I think that the practices will do better. You know, just hang in there, everybody.
And we've
And
been through this before. This has happened before, and we all survived. I
yeah.
mean, different times, 2008, things have occurred in this manner. So you're right. Hang in there.
So once again, I'd just like to thank the Philips Corporation, Philips Oral Healthcare. Thanks to all the people there. Thanks to you, Joyce, for spending some time with me. And everybody, please stay safe and be sane and have common sense. And I think we'll all be great.
Okay.
I'll
You
see
have
you
a
all
good night.
soon. Okay, and I'll see you guys all soon.
Okay, bye.